Hi, it's Dr. Toya. I am back with part 2 of travel in pregnancy. This is the second trimester. I covered the first trimester in another video that I will link below. And I just wanted to talk about safety in pregnancy in this second trimester. So travel in the second trimester is usually ideal. You don't feel as bad if you had any nausea. The fatigue has gone away, but there still are things to consider if you are traveling in the second trimester. And I like to break it up into before 24 weeks and after 24 weeks. So before 24 weeks is really ideal. The risk of anything happening is quite low. You still have a little bit of a bump. So if you want to take pictures, you can do that, which is what I did for my first pregnancy. And, you know, in general, it's a good time to travel. After 24 weeks, this gets a little bit tricky because 24 is where we consider the fetus viable. So if you go into labor, the baby has a chance of survival. That date changes depending on where you are in the world. So some places do not have the resources to resuscitate a baby that is that small. So their viability may be much later, like 28 weeks. So, you know, nobody wants to think that they're going to go into preterm labor so early, but things happen. So making sure that you are aware of that and doing your research about where you're going, what resources are available. And then you may consider, you know, if you are at increased risk for preterm labor, maybe not traveling past the 24-week mark and just being closer to home. But overall, for the average risk person who is pregnant, the second trimester tends to be ideal. And with every part of pregnancy, the longer you are on your trip, meaning long plane rides, long drives, then your risk of blood clots goes up. So making sure you take precautions to prevent that from happening. And of course, talk to your doctor about all of your travel plans and what needs to be done. All right, so make sure you follow for part 3, third trimester travel.